Morning. Thank you, Governor. I'm delighted to be here today to discuss an update on our state's COVID-19 vaccine distribution plan. While life will not return to normal immediately, with this, we do have a sense of a light at the end of the tunnel. I also want to caution that we're working very closely with our federal partners and learning new information every day, throughout the day, in fact, and we will continue to update you as we move forward through the vaccine distribution process. With that, here's what we know today from the FDA. Two companies, as the governor mentioned, have applied for emergency use authorization for their vaccines. The Pfizer vaccine has a 95% efficacy against COVID-19. 2 doses are required 21 days apart. And the vaccine requires ultra-cold storage at temperatures of negative 70 degrees Celsius. Once thawed, the vaccine is stable at refrigerator temperatures for 5 days. We've secured 39 locations that can accommodate ultra-cold storage, and we are working on more. Multiple state partners and private businesses have offered support for this function, and for that, we are tremendously grateful. The Moderna vaccine has a 94.5% efficacy against the coronavirus. 2 doses are required, 28 days apart. However, this vaccine requires a more traditional storage temperature at negative 20 degrees Celsius and is stable at refrigerator temperatures for 30 days. As I mentioned, we've been working very closely with our partners at CDC, and we've long expected additional guidance around allocation to critical populations. As you can imagine, and as we outlined in our state plan, we have a significant number of populations that fall into this priority category. So some prioritization within this category, sub-prioritization, is necessary. Earlier this week, we received a first piece of guidance that helps us with this effort. The Advisory Committee on Immunization Practices issued priority group recommendations for initial doses of COVID-19 vaccine. Those include, as the governor mentioned, healthcare professionals and long-term care residents and staff. As more COVID-19 vaccine becomes available, additional populations will be added and more people will be able to receive the vaccine. We anticipate that by mid-2021, there should be enough vaccine available for anyone who wants to receive it. With that information, we'll position the first distributions in hospitals and we'll start to vaccinate healthcare professionals, but our strongest focus will be on long-term care residents and their direct care staff. The CDC is allocating the COVID-19 vaccine to Iowa based on population size and these target populations. We will pre-position a portion of our initial vaccine allocation to healthcare facilities and reserve the remaining initial Pfizer vaccine allocation for the long-term care pharmacy partnership. That partnership came to be early on in this planning efforts. It became incredibly clear that our most vulnerable population is in long-term care facilities. Part of the challenge in vaccinating this population is that their workforce is already at capacity responding to the pandemic. The federal government created this pharmacy partnership program, which leverages national pharmacy chains to assist in administering the vaccine to our long-term care facilities. This is free of charge for the facilities, and as a state, we have opted into this option. We are working on the timing of activating this partnership program. CVS, Walgreens, and Community Pharmacy are the national chain pharmacies selected to participate, and they are responsible for providing distribution logistics and workforce to administer the vaccine. This program ensures vaccine access to the rural parts of our state, as these pharmacies are able to serve any long-term care facility within a 75-mile radius of their locations. Iowa will receive its first allocation of the Pfizer vaccine, as the governor mentioned, the week of December 13th. Again, these are planning numbers, so this is subject to change. We will pre-position a portion of those doses at 6 healthcare sites. These are in major metropolitan areas, and we worked in direct consultation with the CDC to determine these locations. On the week of December 20th, Iowa will receive a second allocation of Pfizer and the first allocation of Moderna. And by week 2, we anticipate actively deploying to long-term care facilities through the pharmacy program. The week of December 27th, Iowa will receive additional allocations of Pfizer and Moderna. Going forward, while ACIP has provided clarity on these priority populations, we will convene a team of external and internal subject matter experts, known collectively as the Infectious Disease Advisory Council, or IDAC, to provide additional clinical guidance. This council will assist the state in developing COVID-19 vaccine prioritization of populations for early stages of vaccine response when supply is limited. This group will bring together ethical and clinical expertise from across the state to represent multiple perspectives, including rural and urban populations, hospital administration, infectious disease specialists, vulnerable populations in congregate settings, advocates for aging populations, and individuals with intellectual and developmental disabilities, and refugees. The reason for this is to minimize health inequities based on geography, poverty, and other social determinants. This group will also provide input as additional vaccines become available and will help us navigate our distribution of therapeutics. We're solidifying commitments to this council membership, and we'll share this framework publicly on Friday, along with our updated vaccine distribution plan. We will continue to provide regular updates as details and federal guidance are solidified and confirmed. For these future updates, transparency is key. We want Iowans to know when you and your loved ones can expect access to the vaccine. However, I want to level set some expectations around information shared. We will not post locations of vaccine positioning or other critical infrastructure detail to ensure the safe distribution of this limited resource. And we're working with the Department of Public Safety and their federal partners on that security plan. But we also recognize Iowans want to know who will get the vaccine, when, and we're trying to strike this balance between keeping everyone informed and ensuring the safe distribution. In addition to vaccine distribution, we're seeing tremendous progress in the availability of therapeutic treatments. We're actively receiving new shipments of therapeutics to our hospitals, and we're currently on the 4th week of receiving Eli Lilly's therapeutic and our 2nd week of receiving Regeneron's therapeutic. Each week, HHS allocates a certain allotment, and HHS uses hospitalization and positive case data to determine the state's allocation. To date, 112 hospitals in the state of Iowa has received these doses, and it was recently approved for states to begin distribution to facilities other than hospitals, and we're working on that plan. So while this is long-awaited good news, I want to underscore that life will not immediately be back to normal. Please continue all of the necessary mitigation efforts. Please wear a mask, minimize or eliminate gatherings. We have winter months ahead and need to ensure our healthcare workers remain able to provide the highest level of care to Iowans.